Again, my name is Morgan Simonette, and I'm the Director of Membership here at the Howard County Chamber of Commerce. I really appreciate you all being here and joining us today for the new environment of healthcare. We are definitely excited to have our speakers today in our panel, and we know we're going to have a great discussion. First, thank you to our speakers. We have Ashok Kapur, who is the founder and CEO of Hawkeye MedTech, Inc. We also have Kimberly Prescott, who is the founder and president of Prescott HR, who will also be acting as our moderator. And then we have Gabby Gold, who is the director of network strategy and innovation at CareFirst BlueCross BlueShield. And thank you for the CareFirst representatives here. I know that you're showing strong, so that's awesome. Next, we always like to thank our annual partners. Without them, we would not be able to do these programs that we have. We would also not be able to be as such a great grand chamber to bring the business community all the great events and programs that we do. So we always want to thank them. And then always promoting our future events. We do have a trip to the French Riviera, which you do not need to be a chamber member to go to. It's going to be in October of 2022. And this is very much an informational session coming December 13th. We also have our Biz Breakfast, which is going to be December 15th from 8:30 till 10. And this is going to be at the new SparkSoft building. So by all means, if you are in that government contracting world and want to discuss with about the National Institutes of Health, that is going to be the topic. Then we also have our Grand Winter Mingle, and that is January 18th from 6 to 9. That's a save the date. And just as a side note, we also have a lunch tailgate that's December 16th, which does have limited slots. So by all means, if that's something that you want to do, it's a lunchtime program from 12 to 2. It's at the Community Ecology Institute. And basically that is an event where we just very casually mix and mingle. It will be outside by a fire pit. So hopefully that'll help keep us all warm, but it will also be comfortable for people that are in any level with the pandemic right now. So again, trying to still do events geared towards every single individual that we can right now. And that is it. So I'm going to stop sharing my screen, and I'm going to introduce and pin the team really quickly. So bear with me. So I can start spotlighting. There we go. All right. And starting with you, Kimberly, I'm going to go ahead and ask for you to introduce yourself, and then I'll go to you, Gabby, and then you, Ashok, and then we can get this program started.
Thanks, Morgan. I'm Kimberly Prescott. I am the president of Prescott HR. We are an outsourced human resources firm based in Columbia, and we provide, we are the HR department for small to mid-sized businesses.
Gabby?
Hi, good morning, everyone. Thanks so much for inviting us to participate in the panel today. My name is Gabby Gold. I'm the Director of Network Innovation and Strategy for CareFirst BlueCross BlueShield. I've been in healthcare for about 10 years now, and I'm excited to be a champion for value-based care and talk to you all about it today.
Good morning, Ashok Kapur, founder and CEO of Hawkeye.
Oh, Ashok, I think that we lost your sound.
Hello?
Oh, yep, you're just a little low.
Is this better?
Not too much.
Let me switch to my phone, sorry.
Oh, now you're good.
All right. Ashok Kapur, CEO and founder of Hawkeye MedTech. We are the provider of
Oh, Ashok, okay. Maybe I would say switch to your phone. I'm sorry. You sound great, and then you taper off a little bit. That's okay. These things, happen every now and then. That's why we have the phone numbers, right?
Yes.
There we go. Once I see it going on, or once I see you log in, I'll accept it. In just a moment.
Is this better?
Yes.
Awesome. Sorry about that. Ashok Kapur, CEO and founder of Hawkeye MedTech. We are the provider of Total Care Telehealth platform. And Total Care is more than just a video platform connecting patients to their own healthcare providers.
Excellent.
Glad to be here.
We heard you all the way for that. So perfect. All right, Kimberly, I'm going to pass it over to you, and I'm going to go ahead and mute myself, and thank you all for being here.
And thank you again. So today we're going to talk about healthcare and how healthcare delivery has changed and has transformed over the last, I guess we can say, couple of years at this point. So I will direct my first question at Ashok. What are the advances in the telehealth industry?
So let me first quickly digress and talk a different differentiation between telemedicine and telehealth. You hear a lot of these, and I wanted to differentiate that very quickly. Telemedicine is basically providing medical medicine over telephone or video or anything. And telehealth is telemedicine plus healthcare related options and tools. So telehealth. So telehealth has been around for some time, and during COVID, the use of telehealth increased because the insurance reimbursements were there, and healthcare providers were forced to use it because they could not bring in patients into the office. And that has created a lot of advancements in the telehealth, where it's gone from more than just a video platform over to added features, for example, like remote patient monitoring, where now patients can start taking their vitals and putting it on the platform, so healthcare providers can much better manage, get the data they need for the patient's blood pressure, temperature, blood glucose readings, and be able to provide evidence-based medicine to see how the trend lines are going in with the chronic disease and be able to manage that better. In addition to that, there are many connected devices that have come on. This watch that I'm wearing is a passive monitoring device where now you don't have to put a thermometer in your mouth or a blood pressure cuff and stuff. All you do is wear the watch and check your temperature, blood pressure, and a lot of other readings. There is this one device that can be used for doing dental. So now you can get initial consultations with a dentist remotely. Then there is this tool that you can plug into your phone and be able to go in ears and be able to get a view of the eardrum and send it to the doctor. So especially for pediatrics, where whoever had kids, you will see, a lot of the pediatrician appointments are going with the eardrums and the earaches and stuff like that. So if you can send a picture, it saves the trip to the doctor's office, and they can actually be able to diagnose what's going on, be able to prescribe. And then you go beyond that, and you hear a lot about mental health issues with during COVID, and also chronic disease management of patients with chronic diseases. There is research that indicates about 50% of patients with chronic diseases have undiagnosed depression. So now advances are coming out with AI and stuff, where just taking a picture over a period of time, it can indicate to the doctor that this person may show signs and symptoms of depression. So now the conversation can be started much earlier on. And same thing with a lot of other modalities are coming, where it is helping early diagnosis of chronic conditions and early diagnosis of certain other chronic mental conditions that can help with early intervention, so you can stay home healthier and have less hospitalization.
Thank you for that, Ashok. And I guess one question that I have, and then I'll ask Gabriella if she wants to chime in on that question, unless I'm absolutely behind the times and I order everything from Amazon, but I haven't ordered any of those tools that you just showed us. So tell me a little bit about when and how an individual would use or request those types of tools and equipment in order to receive remote healthcare?
Right, good question. So this watch that I am showing, that took us about a year of research and about looking at 20 or 30 watches of researching, trying to find a watch that was good enough to be able to record all these data points. These advances are still coming online, and this is not a medical device yet. It's still, quote unquote, a fitness device because the readings are not FDA approved yet. So these advances are still coming on the market. We are integrating this into our healthcare platform. There are a lot of other manufacturers that are creating these watches. Apple Watch, does certain metrics. Garmin has a lot of watches that have certain metrics, but you need to figure out how your telehealth platform integrates with those. Otherwise, you are stuck with going to Garmin's portal for one thing and somebody else's portal for something else. And now you have, not only do you have patient portals like My Chart to go to, but now you have 10 other portals for all different devices. So these advancements are still coming in there. It will take some time for that to consolidate and have everything on the same platform. So this is some research you have to do. As far as this device, I did buy it on Amazon, and this also on Amazon. These nicely, they connect to your iPhone or Android and be able to take pictures. And if you are on the platform, on your telehealth platform with your healthcare provider, you can actually do this in real time with them, or be able to take a picture and send that picture over to your telehealth platform. So it's not very clear and simple or easy things. Step 1, 2, 3. There are patients have to do their own due diligence or research for now until these advancements come on the market and they're integrated much better into different telehealth platforms.
Thank you. Gabriella?
Sure. So I think as an insurer, it's our responsibility to finance care in a way that drives value and outcomes for our membership, our providers, patient, and your employees, right? So we're all after the same outcomes, the same value for the individual. We just call them something different. And what I'm really proud to say is that CareFirst has been funding or reimbursing for telehealth visits long before the pandemic happened. And we were particularly excited to see the adoption of telehealth by our provider networks. We had been out there encouraging the use of telehealth, helping them with funding initiatives to enhance their technology and their capabilities. We have also provided telehealth directly to our membership. And all of a sudden, COVID gave us an excuse to see an uptick in adoption. And, it was amazing to see the entire healthcare network, the entire system, be able to turn it on and operationalize it so quickly. And we're proud to be able to fund that. And part of value-based care, and I think I'll get into this a little bit later as we ask some more questions, is about ensuring that we can finance the type of care that we want to see. And when we talk about value-based care, it's taking away some of those barriers of requiring certain types of services or requiring care to be delivered in a certain way, and relying on our providers, the folks who are actually caring for our members, patients, employees directly, to care as they see fit, and we finance in that manner as well. So telehealth is a great thing. It's appropriate in many cases, and we're happy to support it.
Thank you. So, as you talk about the impact to employers and the fact that the adoption rate has gone up, from your experience and kind of the feedback that you've been receiving from the business owner perspective or the leader perspective, what benefits does telehealth offer to the business itself and to its employees?
Sure. So I'll take a stab at that first, and then maybe I'll pass it along, because I'm sure as the technical company, there's some feedback as well that can be valuable. So employers appreciate the flexibility that telehealth offers, right? It's a service that can go directly to their employee in the comfort of their schedule and the comfort of the setting of their choosing. So there's a convenience factor to it. I think there's also an efficiency factor in that it saves time, right? And resource from having to actually physically travel to a doctor's office. And I think the third thing is it removes a certain stigma of going to the doctor. So the reality of needing to seek care can sometimes be overwhelming and burdensome. And with telehealth, you can access it from a device, from a computer, from a phone. And that's certainly an exciting proposition. I think for our provider network, it's been particularly important because when they had to close their doors, when they couldn't see their patients in person for that period of time in the early pandemic, when we weren't sure, how COVID was being transmitted, what types of cleaning precautions were necessary. The only way they had to maintain contact with their patient panel was to use a telehealth option. And we saw some great success stories there. And I think that that's a huge benefit to employer groups, obviously, as well, because you all are interested in making sure your employee population stays healthy and engaged with the healthcare system when they need it. And telehealth is a great option.
Thank you. Ashok?
Yes. So as Gabriella said very nicely, that telehealth at work is a great convenience factor because now you don't need to take time off from work and seek medical care. And that sometimes becomes an impediment for you to seek the care you need because you feel guilty. You are two excuses that you have so much work to do and you don't want to take time off. So what happens is, especially people with chronic conditions, their chronic conditions exacerbate. And now you're actually taking much more time off or end up in a hospitalization event as opposed to taking the care that you need when you need it. So telehealth gives you the flexibility whereby you can schedule a call during your work time and then go in a conference room, close the door. If you have an office, close the door and be able to take a 15, 20-minute call with the healthcare provider and get the care you need while you're at work. And same thing for if I have to take time off, if my mom needs to go to doctor's office and I need to take her to the doctor's office, I don't need to take an entire day off. I can be, again, at work and be virtually connected to my mom's doctor and be able to participate in her healthcare visit remotely when I'm from work. But that also increases employee satisfaction because a lot of employers are looking for ways to give benefits to employees. And this is a great benefit to offer. If you offer a telehealth platform, not only are you improving their health, but you're also giving a great benefit to them. And third thing is employee productivity goes up because absenteeism is reduced and their health is improved. So both ways, the productivity goes up. So I think it's a win-win for the employer and the employee.
Yes, and I definitely can say that I have used it, and I've used it for my daughter recently. She had a doctor's appointment. I was able to actually just go to her school. She did her appointment in the car and she went back into school. It took maybe 15 minutes, so it definitely helps. So let me ask this question. We don't know where we are going to be with, the various variants, right? And so every time we think we're going back and we kind of don't. But when we do get to the point where we're going back to quote unquote normal, do you think that telehealth and telemedicine are here to stay?
I'll take that first. Telemedicine is here to stay. You cannot close the door on telemedicine anymore. Telemedicine and telehealth has been around for decades. And part of the impediment for its growth has been lack of consistent reimbursement. And I'm very glad to hear that Gabriella said the Blue Cross has been paying it. They're correct. They've been paying for it, but a lot of the other ones have not been, and there has been a mixed landscape from the healthcare provider side. Some pay for it, some don't pay for it. Some pay for it certain medical conditions, and they don't pay for it other medical conditions. It's such a complex landscape. So the healthcare provider not only have to deal with 200 different insurance and variations of that, now you need to deal with the variations within that about what is covered in telehealth. It's easier for them to say, I don't want to do it, bring everybody to the office. But now with the telehealth and the at-par reimbursement and mandatory reimbursement through COVID, it's going to here to stay. I think Gabriella can add some stuff to it, but Congress is passing laws to keep those reimbursements in place. States like Maryland have passed laws to keep them in place. And people are demanding it. The voters and residents and people like you and I are demanding that telehealth continue. And the research says that after everything is settled and COVID is settled, about 30% of visits will still be done through telehealth on an average, right? Some of the specialties may lower it, PCPs may increase it, but average is about that.
Gabriella?
Yes, telehealth is here to stay, absolutely, and we are happy about that because we would like to see the healthcare system designed in a way that we're delivering the right care at the right place at the right time for the right price. And all four of those things, when you consider sort of the quadruple aim, telehealth is a key tool in our toolbox to accomplishing that when it's appropriate for the patient. There's some great questions in the chat, and I think they sort of allude to telehealth in a sense, and I definitely the first one. So if it's okay, I'll read it out and maybe we can take a stab at addressing it now. What are the biggest impediments for more physicians and providers to sign up with telehealth platforms? And I'll certainly share my perspective, and then Ashok, I think you would have a good one as well. So financing technology investments is something that our provider community certainly focuses a lot on. The way our existing reimbursement structure, payment structure for healthcare is set up, we don't necessarily make it easy for our provider community to invest in telehealth platforms. That said, this movement towards value-based care and moving away from payment per widget or payment per visit and moving towards payment for value and outcomes enables our provider community to leverage a financial reimbursement model that can fund things like an investment in a telehealth platform. We've done lots of things with our provider community to encourage investment in telehealth through value-based arrangements. So provider incentive payments and other types of funding that can be channeled directly into population health programs, some of which is appropriate for telehealth. So we've seen an uptick in the technology. The majority of our provider network is offering telehealth. And then additionally, we provide a second layer of support for those members who don't have a regular provider or whose provider doesn't offer a telehealth option. There's an option directly through CareFirst to access telehealth services as well. Good question.
Thanks, Gabrielle. So yes, let me regress back to about the benefits of telehealth. I forgot to tell one more benefit is research is, proving now and also that use of telehealth actually saves healthcare dollars in the end because it actually reduces hospitalizations, which is the biggest healthcare expense. So that's one of the other reasons that telehealth is here to stay. Talking about impediments of adopting telehealth for physician office, Gabrielle, as you said, it's an investment that a practice needs to do, which means you don't just pick up the first one that comes to your door or the first one that is the lowest cost. Every practice is different. It needs to be an investment in a project that the practice needs to invest in. So, okay, what is my workflow? What telehealth platforms are out there and what are closest to my workflow so I can implement that and have a champion within your practice that actually does the study, does the implementations, does the support, so that champion is there. And many times what I've seen during COVID is since it was an urgent thing, they just picked up any old telehealth that came on. It's a free one, I'll take it. It says HIPAA compliant, I'll take it, right? And then now they're struggling because it's really an impediment to their entire workflow, and the practice is not increasing efficiency. They're spending about anywhere from 5 minutes to 45 minutes for the patient to come on the video call, and that is highly inefficient for a practice. So that's what I would say is take time to do the study, to understand what are your options, and figure out which one fits best for your needs, not only today, but the future needs also.
Yes, thank you. And we did have one more question in the chat. And that question was, what kind of innovative payment arrangements are being offered in the region to encourage providers to meet set quality standards designed to improve patient care and outcomes? So I think that kind of leads us into our value-based care question. So I guess I'll just ask that question as well. We'll just combine them together. So what is value-based care and how is it helping to shape the future of healthcare? And then I'll let Gabriella start with that one.
Sure. Wait, I love your question. You used all the right buzzwords: innovative, set quality levels designed to improve patient care and outcomes. So when we think about value-based care, what we're focused on is delivering value and outcomes for our membership. So this is not a novel concept, right? Every business is interested in introducing value to their consumer population. That's why they exist as a business. And so when we think about the way that we can drive value and outcomes for our members, it's by designing these unique payment models that encourage our provider community to deliver care in a way that produces value and outcomes. We right now have a fee-for-service system that pays for each individual medical visit with very strict, highly regulated requirements around what it can be paid for. This can be limiting. It's complicated, and it certainly takes some creativity away from our provider community. Through value-based care, through changing the way that we pay for care instead of requiring this fee-for-service infrastructure, and by breaking down some of the requirements, so what is required of our provider to receive payment, we can actually innovate and create some more creative solutions. So an example of that is, instead of paying for a very particular type of visit every time a member comes to see them, we would pay them a set amount per month to care for that member's health. And we would adjust that payment based on the risk acuity of the patient. So understanding that they may have some underlying conditions that could inherently be more or less expensive, but also understand that we want to see improvements in quality of care for that member. So we would track outcomes, we would make sure the care is being well coordinated, and all of this is possible because we have integrated technology now, because we can review data, we can understand where there are gaps in care, and we can be a support system for our provider network in providing that best quality care for our membership population. So what are the specific payment models that we have designed right now? We have a patient-centered medical home that's been in our market for over 10 years, and that's focused on primary care. And what that does is it puts our primary care providers into population health panels and helps them focus on understanding care patterns and outcomes for their membership, and incents them to meet certain quality metrics. We also have accountable care organizations now that are focused on our health system partners. So primary care is very important. How do we then address our hospitals and health systems? So those large providers of care, those accountable care organizations have similar population health targets, focused care coordination efforts, and joint governance committees. So representatives from the provider, representatives from us as the payer, to really drive value and outcomes for our membership and pay our providers accordingly. And then the third category that we've been focusing on are episodes of care, because our specialty care is very important and obviously drives a lot of costs in our system. When we think about maternity care or joint replacements, these are key episodes that are often costly for our employers. And so setting very particular cost and quality parameters around those episodes and encouraging and incenting our providers to meet quality targets. So we've been at this for a while. We're excited to continue along the journey and really look forward to all the innovation that shifting the focus on fee-for-service to more of this value lump sum payment can create.
So value-based care is great examples, Gabriella. I'll give you a practical example. So say you're wearing this watch and it's taking your vitals on a regular basis. Can you imagine getting a call from the doctor's office saying, hey, your blood pressure is trending the wrong way. Let's make an appointment and figure out what's going on. That's really totally different than what you do today. Today, you call the doctor's office and say, I'm not feeling well. Can I make an appointment? That's part of value-based care. Now, because doctors are being incentivized, when I say doctors, I'm going to say healthcare providers, because more than just MD. So they are being incentivized to keep you healthier at home, keep you out of the hospital. And that's part of value-based care. Another example I'll give you, the question was in this area. State of Maryland is very unique in the Medicare world where they are a incubator or the pilot site for innovation. And in 2019 or 2020, they had come up with a way that hospitals are going to get a quarterly bonus based on reduced number of ER visits, which means they're incentivized to go out to the community and reach out and do proactive health monitoring and keep them healthy so less of the population ends up in the emergency room. And think about it, that's turning the hospital's revenue system on its head because they make most of the money when people come to the hospital. Now we are saying we're going to give you money when less people come to the hospital. I think that's pretty cool.
Yes, and I actually was going to comment on that because I know Gabriella mentioned that value-based care is not a novel idea. It has been around, and particularly in hospitals and emergency rooms, the incentives were around making sure that they provided the type of care so that there wasn't, I don't know if recidivism is the right word in this particular instance, but it's the word that comes to mind, return ER visits for the same. Yeah, yeah, return, ER visits for the same issue are being measured, and then there's a decision around whether there's reimbursement. So I guess I know you talked about, Gabriella, what value-based care is in setting those goals. So of course, as you implement things, there have to be phases on, we're starting this and now there's goals, there's measurements. What does the long term look like around ensuring that this actually happens across the long term?
That's a great question. We're actively engaged in this work on a regular basis, and I would say we have two really keys to success. So one is that as CareFirst, we have the unique responsibility of being the largest payer in this region. And what that means is that we drive the majority of the revenue for our provider network. And these providers look to us for help in transforming their practice. So we have an obligation to make sure that we are helping them continue to transform their ability to deliver care and generate value and outcomes for their patients and our members and your employees. So we take that very seriously. What does the future look like? To me, the future looks like payer and provider are sitting on the same side of the table, and we're working together through those joint operating committees, through a deep consulting relationship to make sure that we're continuing to improve the way we deliver care, and that the clinical programs that we as the payer are rolling out are in lockstep with the clinical programs that the providers are leveraging as well. So that's one, a deep connection with our provider network and community, because we have that unique obligation of driving the majority of the revenue. I think the second piece is making sure that all of our payment models align with what our other payer partners are doing, because even though we are the majority of the revenue, we're not the only payer, right? And so we need to be cognizant of what's happening, what CMS is doing specifically here in Maryland. How is the Maryland model impacting the way that our providers are receiving payment, and how can we align with those models? Making sure that we're aligning with our other commercial carriers as well to ensure that our provider community is benefiting from all this transformation and not just overwhelmed with another program that they need to check the box. So, two things: engaging with our provider network very closely, and then secondly, just making sure that we continue to align all of the payment models.
So I'll give you another picture of it. Primary care becomes the center of your healthcare, and all the other specialties hospitals are coordinated along together. So primary care for PCP becomes the central focal point of all the data coming in and out. So you go to a cardiologist, you go to an ortho, you go to an urgent care center, you go to ER, your primary care provider becomes the conduit and manages all that stuff to make sure that you are getting coordinated care and your healthcare is much better. And also giving the tools to the patients to be able to manage a lot of stuff yourself.
Yes, thank you. So this is an employer group. So can you tell me what benefit value-based care has for businesses?
Sure. So I think we've touched on a lot of them. Unique payment models that address funding telehealth options, which is a convenience for your members and certainly makes care more accessible and more affordable. I think also it's enhanced experience of the healthcare system for your employees. So if they become engaged in a value-based care model, some may not even realize it, and others will really feel it because they're going to have enhanced care management services wrapped around their experience in the system. So that means dedicated attention to the type of care that they're receiving, starting with that PCP in some instances, right? And making sure that it's well coordinated with their specialty care and their hospital care if needed. Or it could just be a really tight and efficient experience of a clinical episode. So if I need my knee replaced, I know that I can be directed to a provider who's engaged in a value-based care model that focuses on joint replacements, and I can be confident that I'm going to deliver and receive the value and outcomes that I should expect from my provider and the healthcare system at large. So I think it's all in the effort of enhancing and increasing affordability and enhancing outcomes and patient experience and quality. So if you're a sort of typical healthy employee who's like me, never goes to the doctor, my experience probably won't be very different. But if, for instance, I do need to seek care, hopefully it'll be very well coordinated and affordable.
Yes, and I think, when I hear my clients speak, they're always thinking about premium increases year over year. So managing chronic care in this instance and chronic, conditions in this instance could potentially have an impact on those increases year over year, because the reality is that that's a lot of what businesses are thinking about, is how much is healthcare going to cost me and cost our employees year over year. Ashok, did you have anything to add to that?
Yes, I'm glad you mentioned chronic care and the increased healthcare costs. Did you know that 90% of our healthcare spend annually is on chronic disease management? So if we actually use value-based care, and also what Gabriella mentioned, when you have surgeries and other specialty care, and your value-based care is outcome-based, so make sure the end result is you are healthier, overall the healthcare costs will go down, which means that employers who are self-insured, their cost of healthcare will go down, which means they can, and as an employee who is either in a self-insured employer or in your own private insurance employer, your healthcare costs will go down and your value for your healthcare will increase. It's not going to be fee for service, which is you are driving it and you're getting billed for every line item. Now you're going to be billed for you staying healthier. So it's a different model. I think, Gabrielle, correct me if this is wrong, it's going to take some time to get it all implemented, total value-based care, the way you are envisioning, but it's a small baby step to make this happen, and I think we are heading in the really right direction.
Yes, so thank you for that. And so we have another question in the chat. The question is, obviously COVID has had an impact on telemedicine, but how has COVID impacted the broader quality-based, value-based care arrangements? Are things continuing to move beyond fee-for-service, or has it slowed?
That's a great question. This is what I like to think about impact of COVID on our members and on our providers. I'm going to start with our provider community. So our providers are mostly small businesses, just like many of you. And when COVID happened, in the initial stage of the pandemic, they had to close their doors. So what does that mean? They close their doors, they're not seeing any patients. They're not able to bill that fee for service. So what happened? Their cash flow slowed down. So it's our responsibility as the insurer to offer a provider network. And so we care very much about the health of our providers. And so we helped to provide some investment into those practices, into our small business provider-owned healthcare companies, right? While they weren't able to receive payment on a traditional fee-for-service infrastructure. That very much motivated this transition to value-based care. Because if I was no longer, as a provider, responsible for seeing a patient walk through my door in order to bill for a visit, but I had guaranteed cash flow for producing certain value and outcomes for that patient, COVID would not have been as big of a financial issue for our provider community as it was. So, I think that it's actually accelerated the value-based care discussion. I think we have some way to go in bringing our policymakers along with us, but I think that the provider community is very excited about the prospect of more regular cash flow and payment for the production of value and outcomes instead of payment for the one service, right? Because at a time when our communities needed clinicians and healthcare most, the doors were shut. And so we relied on telemedicine, which was a wonderful first step, but we need to go beyond that, and we need to make sure that the payment structure allows for that creative provision of care and to ensure that our membership has access when they need it most.
Okay. So I think this has been such a robust discussion about, healthcare and telehealth and how we are creating value for employers, for their employees. And I know that when we think about healthcare, it doesn't just always happen when someone is an employee. Sometimes it's when the person is no longer an employee in the continuation of coverage. So one question that I wanted to kind of cover is, have there been changes in the COBRA laws that could affect business owner obligations? And so from an HR perspective, yes, there were definitely some regulations that impacted employers and their obligations. And to be very honest with you, we're still navigating what that actually means. There was a subsidy that was in place earlier this year. It expired, but there are still some questions around eligibility periods. And, if people didn't elect during that period of time, can they go back and can they go back and elect and get those subsidies for themselves? So yes, employers definitely had some COBRA issues that they needed to address, and not just for our employers that were required to provide continuation of coverage that were over 50. So the federal mandate, of course, there are some state continuation requirements as well that they had to navigate through. And unfortunately, there are not a lot of clear answers about that. But there are a lot of great providers in the marketplace that do COBRA administration specifically that have been able to provide some good guidance for employers, because this particular area, as is the case, quite honestly, with a lot of the regulations that passed during COVID, we don't have a lot of case law or, quite honestly, even clarifying guidance on those regulations to assist us with understanding how to navigate through it clearly. So I wish I had great answers for that. I don't, but there are definitely some providers that, again, that do COBRA administration that can provide some clearer guidance, quite honestly, specific to your organization, your size, and the needs specifically of your organization. So I don't know if anybody wants to kind of weigh in on that at all. Okay, looks like a no. All right. So I don't know if anybody in the audience has any questions about that. I know that that's not an answer, but to be honest with you, I don't know that we have a lot of clear answers and guidance to give. But what I will say, though, is that there were many people who lost their jobs during COVID for various reasons involuntarily. And so the need to continue their healthcare was absolutely there. And I don't know if anyone is able to address just specifically whether or not there was an increase, decrease, or if it stayed the same with people accepting the continued coverage. Because I know from an HR perspective, it's typically a relatively low number of people that opt to continue their coverage when they leave their job. So I don't know if you saw any changes in election or if it stayed steady or if it dipped. I don't know if anybody can speak to that. Okay, the answer is we don't know. All right, so all right, and then the last thing that we're going to cover is, are there any new regulations or requirements that businesses should know about? So is there anything on the horizon that businesses should know about related to either, healthcare or anything COVID related that would impact businesses from a healthcare perspective?
I think if I can jump in, not new regulations, but I wanted to talk about HIPAA and privacy for a little bit, right? So HIPAA and privacy for healthcare providers and for employers in general. When you're trying to get a telehealth visit, it's a medical visit, so privacy is paramount. So which means, either as an employer, you may provide as a benefit, designate a room maybe as a telehealth room, which is a private room, right? Many times you are in a cubicle setting and you cannot do televisits there. Or you are in an office setting, but the offices usually have very thin walls. I've been in some offices, very thin walls, so you can get across. If you can set up a dedicated telehealth room and provide a laptop or something, and maybe a blood pressure machine or something, so it looks like a little medical room, that may be a great benefit to employees. So now you can go there and get your telehealth visits if you wanted to get there, right? And it's private, so nobody else can, you can have a private conversation, feel very comfortable talking to your healthcare provider. Second thing, from a medical provider and HIPAA, and privacy, that's one thing that I would like to address is during COVID, we had what is called EUA, Emergency Use Authorization, where states and federal opened up healthcare providers to use any and all platforms to get in touch with their patients. They could use FaceTime, WhatsApp, Zoom, any of those platforms to do that. And just be aware, none of those that I mentioned are HIPAA compliant. Okay, so are you taking a risk as a healthcare provider to get on the calls with them? You probably are. I'm not sure. I'm not a legal expert, but it's certainly not a HIPAA compliant platform. As EUA is going away and more HIPAA restrictions are coming back, HIPAA is coming back, you need to evaluate what you're using as your telehealth platform. Is it truly HIPAA compliant? Is there privacy there? Is there security there? Is the data that is being transferred back and forth private? Is the channel secure? There is some people say, for example, WhatsApp is encrypted. Yes, WhatsApp is encrypted, which means the data and the communication may be encrypted, but at least the names and who is calling who, all that stuff is available, so it is not private. So be aware of that. Do some due diligence to figure out exactly what platforms are HIPAA compliant or not. If you're in the state of Maryland, of course, you can look at the Maryland Healthcare Commission. They have a list of about 70 or so telehealth platforms listed there, and listed if they're HIPAA compliant or not. So that may be one place you can go to look for a HIPAA compliant telehealth platform, or find out if the platform you are using is HIPAA compliant or not. Medicare also has a lot of documents talking about FaceTime and Zoom and the other things being HIPAA compliant or not. So there is data available on authoritative websites. I'm sure Blue Cross may have some guidance on that too. I'm not sure. But at least Medicare and State of Maryland Healthcare Commission, they have some guidance on that.
Yes, and one thing I will say that I have seen to Ashok's first point around having a space available for employees. I've seen many people convert their nursing mothers' rooms into a space where people can do telehealth. So using it as a dual space, because that's a space that employers are required to have anyway. And it is a private place, well, or at least it should be. Using that as a dual space to for individuals to receive telehealth. So that is an option, particularly if you're space limited, that you can use that space as well. So any other comments from our panel? This has been a wonderful discussion. I've learned a lot. So any final comments from anyone on the panel?
Thank you for your interest, and we hope that your members, your employees receive care from our value-based care providers and encourage them to continue to seek health care instead of sick care.
Yes, thank you so much, Morgan and Howard County Chamber, for having us on the panel, having me on the panel. Love to share all the information. And I don't know if you're gonna, if I can share my contact information, or if anybody has any questions on telehealth in general, I'll be happy to answer any questions with them.
Absolutely. Yeah, by all means, if you'd like to share information in the chat, you're more than welcome to do so. You can also always reach out to myself for any contact information of the chamber. If there aren't any other questions, I'm going to take off the spotlight and I'm just going to share my screen for just one more moment. So just bear with me. Here we are. All right, there I am. Okay. So we'll share the screen. And I personally wanted to say thank you again to our panel. It really was eye-opening, and I love the idea of value-based care. And honestly, I love telehealth too, because for all those small needs, who really wants to drive 10, 15, 20 minutes, wait in a waiting room, go see somebody, drive back home? I mean, it really is a great platform for the smaller needs and for chronic illness as well, if you really don't need to drive to a doctor consistently. So I really appreciate you being here. Again, thank you to the Howard County Chamber annual partners. Without them, we really wouldn't be able to put on these programs for our members. And then our upcoming events, French Riviera, Biz Breakfast. These are all on our website too at howardchamber.com. So by all means, you can visit there. But I just wanted to put a plug in for our winter mingle that is also going to be January 18th. Changed it because of the holiday season, because we didn't want to compete with all the other organizations out there. So we're excited to bring something in January that may not have otherwise been there. And then, Ashok, you had made one comment about HIPAA compliance and data security. And I feel like that really goes into the Chamber does put on a cyber conference each year, but it's really based on protection of your database, of basically your business overall, and how you can provide security and privacy to all of the members and all of the clients that you have. So just keep in mind, we do have that program that's going to come later on this year in June. So if that's something that you're interested as a business owner or even as a attendee, it really is a great program to make sure that you're secure, because we all know that those cyber attacks are coming no matter what. And hopefully when they do come to your business, you are prepared. So just a shameless plug there. But other than that, all have a great day. Hope to see you soon at an in-person event or another virtual or hybrid event. We're really doing it all. And by all means, reach out to me if you have any questions. And if you're not a member, please also contact me as well. All right. Thank you. And everybody have a great day.
Thank you.
Thank
Bye-bye.
you.
Thank you.
Thanks, Morgan.